following episode of the Hook Podcast is with guest Dr. Jonathan Nzoma. Hello, Detroit, and our listening audience. I'd like to welcome you to the Hook Podcast. We're here at the Six Soul Studio as always. And it's a little rainy. The golfers are out, and I don't know how they're doing, but the grass is a little wet, and the greens are a little moist, but they're still out there, doing their thing. Today it's just me. My co-hosts are out today. They have some personal business to take care of, but I'd like to introduce you to a very, very interesting young man, a doctor named Dr. Joseph Nzoma, 46 years old, and he's in orthopedic sports surgery or medicine. Is that correct?
That's correct.
I'd like to welcome you to the show. How are you doing today?
I'm doing fantastic.
Good. Tell us a little bit about yourself, Dr. Nzoma.
Well, my name is Jonathan Nzoma. I'm from Detroit. I currently work in Southfield, Michigan, and I'm an orthopedic sports medicine specialist.
Tell us what that is. What is orthopedic sports medicine?
So orthopedics is a branch of surgery that deals with bones, joints, tendons, muscle, etc. So when people have joint pain or need a knee replacement or rotator cuff repair, those kind of things you see an orthopedic surgeon for.
Okay. So is that more for sports athletes, or is it just for anybody?
Well, when we start in orthopedics, you're general, so you learn everything, and then you can branch into different things. So I started off as a generalist, and I really like that because then I can help kids who have problems from 14 all the way up to seniors. I like that variety personally, but not everybody does see that group. So I decided to do a fellowship in sports medicine, and I did that at the DMC, which is an extra year of training after you're done with your training. So when your training ends, you're a doctor, but if you want to do spine surgery, it's an extra year. If you want to do shoulder and elbow, it's an extra year. If you want to do sports medicine, it's an extra year. So you can choose what you want to do and kind of go in a direction you want to go into.
Okay, yeah, that kind of answered my next question. I know, or at least I've been told, most doctors start off as general practitioners and then they specialize.
Correct.
So you did about 4 years of regular general medicine, and then you specialized and did another 2, 3, 4 years?
So my process was I went to Michigan State for medical school for 4 years, and then I did residency in Chicago. And so that residency program was 5 years. So any kind of surgical program minimum is about 5 years. And so you can be done at 5 years and say, hey, I'm just going to be general and do everything. And then instead of doing that, I said, let me do an extra year of sports medicine, and that will, be something that I enjoy doing, and that's what I'm doing today.
Okay, so how long have you been practicing medicine, and how long have you had your own practice?
I've been out since fellowship. I graduated in 2014, and then my own practice I started in 2022.
Okay. Why did you decide to select orthopedic sports as your discipline as opposed to heart cardiac, cardiovascular, or anything like that?
That's a great question. I really like working with my hands. I've always been a tinkerer, taking things apart, working on cars, etc., being from Detroit. So those kind of things lended me to using my hands. And I'm also one of those people who I enjoy work. Like I enjoy putting in my work, and at the end of the day, I go home and I feel like I did something. So that's really important to me. So finding this was very, very a blessing to me to be able to get into this field. I initially thought I'd be a pediatrician, but even though I love kids, when I had to deal with parents, I said,
just a little too much.
That's a whole nother thing. So this is my lane, and I enjoy being in it.
Okay. All right. What's a typical day like for you? Are you in the hospital? Are you at your office? Do you go to different hospitals? How many do you go to, or are you at one specific hospital?
So another great question. Right now I'm in private practice, so I'm in clinic 3 days a week. So it's usually Monday, Wednesday, Friday. So clinic means I'm going in, I see patients, I see Mr. So-and-so, Mrs. So-and-so for their problem. diagnose them, look at images, etc. And then I'm at surgery on Tuesdays and Thursdays, and that can be in a variety of places. I worked when I was a hospital employee. I was just at the DMC, but now I'm on staff at Henry Ford, Providence. I'm on staff at McLaren. I'm on staff at several surgical centers, and that's where I do the majority of my sports medicine work. So when you have a shoulder problem or a knee or a hip problem, and it's something that can be done at a surgery center, this case may take an hour, a couple hours, and then you can go right home. And so I'm on staff at a few of those around the area, some in Southfield, one in Bloomfield Hills, one in West Bloomfield, and that kind of gives me an area of places to do my job.
That seems like it's really, really exhausting and really busy that you locate and you move around to so many different places. I mean, does that make it difficult to, do a great job? I mean, because you got to bounce from this hospital to that hospital to this hospital. No. I'm not saying you don't, because I know somebody who boasts about you, who is very closely related to me.
Yes.
She told me you gave her another 70 years with your professional and your preciseness. But
yes.
Does that make it difficult for you?
No, it doesn't. And it's not like I'm at all those locations every day. Now, some doctors do. If they're at a bunch of hospitals, they start early and go hit all the hospitals. That's not what I do. So my schedule is I'll have a schedule for this month and next month, and I'll be at this location 1 month, and and so on. And that just allows me to cover more area than I would on my own. And it's pretty typical for private docs to be at different locations. And I have even expanded to having a West Side location and also an East Side location. So it's not as hard for people to get there from wherever they're coming from.
Okay. So most of your surgical procedures are done in the hospitals. Or can you do them at your office as well?
No surgeries in the hospital and no surgeries in the office. The only thing I do in my office would be like minor procedures. There's one called a 10X tenotomy procedure. But besides that, it's done at a hospital. If it's a total joint, for most people, it's going to be at a hospital. There is one surgery center that's well equipped with a robot and everything else I need. But if that place is not convenient for patients, then mostly it's done at a hospital. But for everything that's not a big joint replacement, those can be done at a surgery center.
Okay. Now, joint replacements and so forth, I had a friend who had double knee surgery. It took her months to heal. Then the person I was talking about, my sister,
yes,
I panicked about it because I hate surgery, because anything with a knife cutting scares me. But before she went in to see you, and this is a testimony, people, before she went in to see you, her motion was really strained. It looked like it hurt. She looked like she could barely, it was getting worse, like she could barely walk. And after you, it looks like she can do a 40-yard dash now. And she boasts about you. And watching her, I can't keep up with her. She's moving very well. And it didn't seem to take that long. I know my friend who had knee surgery, it took her a while to heal. But my sister who had double hip surgery, it didn't take her quite as long. Why is that?
Well, I think people heal differently, and then people start in a different situation. So if you look at athletes, they're in great shape. They have an ACL tear, they bounce right back. If someone else is not in shape, great shape, that doesn't lend itself to such a quick recovery. So that does matter. And then also medical problems are a big part of it too. That's one of the things I'm really committed to in my community, is explaining how do we get our health better so that in case we need surgery, we can bounce back faster. But one point of clarification, she had a hip, and then we don't do them. I don't do them at the same time. Some people do, but I would do one hip. Do one hip, and then usually by 2 months, the other one is good enough to do, and then you have both hips done. But I think some of the things that have helped her are that we're using this anterior approach to the hip that doesn't cut any muscles. You just kind of make the incision, spread down to the hip, and then you're able to do the surgery that way. And that leads to a faster recovery. I noted that when I was a resident. You could tell the difference between the posterior and the anterior hip. But the thing is, even at 6 months, that doesn't make a big difference. But immediately it does make a big difference. And I think that matters, and why a lot of people who are having hip replacement today are looking for that option. But knee replacement and hip replacement, typically it should be around a 2 to 3 month recovery for it. But again, it's different for everyone. And then we do know things like getting your quad muscle to wake up after surgery. Those little things make a big impact on how fast you recover.
Mm-hmm. So now I'm going to talk about your office. I visited your office for a minute with my sister. Mm-hmm. And you were in the midst of doing something like a little video presentation and so forth like that. But what I found astounding when I was there, and I am boasting people, is the speed and the politeness, the cleanliness, but more so the speed and politeness of your staff. I think we were in there 2-3 minutes, and a couple of your staff members came in and apologized for making me wait so long. Mm-hmm. I looked at my sister and said, "This is a long wait." And then about 2 minutes later, you came in. And so I was there for the whole 5 minutes, when I'm normally used to sitting for 35, 40 minutes, sometimes an hour, to get seen. You came in. I told you my little issue, kind of like the car. It was killing me the day before, and then it was gone. You sat down and explained to me, gave me a diagnosis and so forth like that within 5 minutes. Is that normal for you? Is that like special just to you, or is that something that you can find elsewhere? I couldn't.
Yeah.
So is this typical for your office?
It's typical for my office. I will say that there is a lot of getting background information, like your medical history, what medications you're taking, and a lot of that stuff is time sensitive. That's probably what takes the longest in my office. So we have like an MA come in and ask those questions and get the information, and I have to review it and make sure everything is accurate. But obtaining that information, unless a patient has it all written down or an easy way for me to access, takes time. But aside from that, we get your x-rays or review your images, and it's pretty easy for me to come in and see you, assess you, et cetera. But, the thing is, whenever you go to the doctor's office, you have to pack your patients, and it also depends on how many people are there in a day. But we do try to be very efficient. And I'm very proud of the leadership in my organization. I read books. I've visited a local business person who's taught me about service. It's very important, and that is really is something that I try to uphold myself, and then also make sure my staff is doing it as well. And they've done a great job so far.
Well, I would say that's a testament to you. And what you expect and what you demand from them. They were very polite, very professional, and when we were trying to get together to set up this podcast, they were Johnny on the spot. I know I missed a lot of calls because I don't answer my phone if I don't know the number, but they reached out, and I just thought it was a wonderful experience, and it was just great that I didn't have to sit there for 45 minutes for you to come in and look at me.
That's my pleasure, and I shout out to my staff. They're who I rock with. They do a great job, and I appreciate them.
Mm-hmm. So, give me. Can you run me through like what a surgery would be like?
Sure.
Some of the procedures and stuff like that, what you have to go through.
Absolutely. So again, I see patients in the clinic. I kind of go over the diagnosis, treatment options, non-surgical options, what you should be able to do and what you currently are able to do. And those kind of help patients decide, hey, it looks like I need to have surgery. Once that happens, there's a process to it. There's ordering the surgery. There's getting the insurance to approve the surgery. There is ordering supplies and things like that before surgery. And then patients have to see their doctor, get medical clearance. They have to get blood tests. But when we actually do a surgery such as a total hip, all those things happen first, and then I meet the patient the day of surgery. Patients have to get there 2 hours before to get an IV in their arm for the medications, antibiotics, and for the anesthesiologist to put them under anesthesia. Surgery, we make like an incision. I do an approach to the hip, for example, and then it's step by step moving through that procedure. So from incision to closing, that may take an hour and a half, 2 hours,
for
plus
a hip?
or minus for a hip. Yeah. Mm-hmm.
An hour to 2 hours?
Mm-hmm. Would you thought it was longer or shorter?
Yeah.
It can be longer if it's a really bad hip or stiff hip, but usually it's around that time period, as long as there's nothing else going on and how tight the hip is.
So they're like considered outpatient surgery nowadays?
Believe it or not, it is. So all total hips and total knees now are considered outpatient. There was a time when patients would be admitted and be in the hospital 7 days, but that time has passed. And what we're going to find is more of these procedures, if people are healthy, are going to be done at surgery centers, believe it or not, and patients will go directly home. But in my case, usually what patients do is they'll stay overnight for a total hip replacement. They will do physical therapy. And so that's the beauty of this approach and them getting back. So they will walk 100 feet. They'll go up and down stairs with the therapist. And once they're safe doing those things, they can go home.
Is this the day of the surgery or the day after?
The day after.
Oh, okay. So
you could do it the same day, but it's not as easy for some people. And so 23 hours, we call it 23-hour observation, but it's basically an overnight stay. But that's kind of the future of joints, is to get people home. And the hospital is great, but I tell people there are things in the hospital you don't want to take home. And then also home is more familiar. You know, you can get into your regular clothes and kind of get back to your routine faster. You don't want to be in a surgery center. So those are some pros of this procedure and getting people home.
Okay, now, I this is going to sound redundant, but when I want you to describe what the process, I'm talking about actual surgery. So, like, you cut them open. Do you put your hands in there?
Oh, no. Oh, yeah. Okay. So I make the incision on a hip, for example. And then the next level is to open up. So that first part, I use my fingers to open, just to hold it until I get a retractor in.
And about how big is the incision?
It's about inches wise, maybe 3 inches, 4 inches.
Okay.
It all, for me, it's, I think, more in centimeters, but yeah, so it's an incision about the size of your cell phone to get into a hip.
Width and length?
Length, just length.
Okay.
And so once you make the length, you're opening the space, and it ends up being more like a circle.
Okay.
And I use a circular retractor. So once that goes in, it's a round thing, and basically there's a circle showing me the front of the hip.
Okay.
And what I'm looking at is a muscle and what's called fascia that covers the muscle. And so I make an incision in that, and basically I mobilize it to move the muscle out of the way.
Ugh.
So nothing is cut
Right.
except for the fascia that covers the muscle. Once I'm in that position, I use these retractors. So imagine like a metal piece that goes in and it goes over the top of the hip and holds everything out the way.
Okay.
And then I have to make some open the space up with some other retractors, and I usually have someone helping me with that. And then I'll use this Bovie device to kind of go down and find the bleeder that's in the hip. Once that bleeder is taken care of, I'll put another retractor around the other hip and then kind of move through. But it's not my hands. We're using these retractors, and then we're using either a sharp knife, or you can use it's like a burning knife that will burn the tissue to open it up and cut the tissue. So it also stops bleeding. So it has two functions, a cut and a coagulation to stop bleeding. And when we get to the hip, we split the capsule, and that opens it up. And then I tag the capsule, open that up, and then I'm looking at the hip. And from there, the only thing that may seem aggressive if you're not used to surgery is once my retractors are around the hip and I've measured the hip length, then we cut the neck and remove the head and neck out of the patient. And that's because that part has the disease, and then that also opens the hip so I can put a stem inside the bone.
Okay, so what's the head and the neck?
So the head and neck, think of the ball in the socket. And
okay.
So in a hip, normally there's space, but in arthritis, that space goes away and there's rubbing and rubbing. I just saw a patient today like that. What I do in my office is I pull on the leg and move it, and they usually say, oh, that feels much better. So I'm pulling away that area that's rubbing bone on bone. So in the surgery, I'm removing that head and the neck, and then that's gone, and then we're resurfacing the cup. So I put a brand new cup in. First, I make it a perfect circle. I use robotic surgery to help me put it in the right space that I want it to be in. Sometimes we use screws to hold it in place if it needs it, or if it doesn't, then it's just a metal cup that the bone grows into. And then into that cup is a plastic liner. And then that's it for that whole half of the surgery. Then I turn my attention to the femur, where I kind of rotate it towards me, make some releases, and there's a hole inside the bone of the femur. And that hole, basically, we size it up until we get to the perfect size. But the beauty of using robotic surgery and getting a CT scan and planning is I know the size of everything before we even make a cut. I have photos and a plan that shows what we're doing, so I know before. And then I just kind of go until we kind of meet. There may be some adjustments in sizes based on what we plan, but rarely. And then once the stem is inside, a brand new ball, put the hip back in place and take x-rays to make sure that the leg lengths are the same on both sides, so the patient is happy. And we can make the leg lengths, as tall or short as we have options for the head and neck. And then that's pretty much it. I work my way out, close the capsule. I close the incision. We wash everything really well, get everything out of there. I even put some antibiotics in before I close in all the different layers. And then for the skin, I use sutures that dissolve. Only if a person has like a bleeding problem would I use staples, but that's pretty much it. Dressing goes on and the patient is able to go right to the recovery room.
You say that's pretty much it, like it's, like it's a cheese sandwich. I mean, that is, I guess if you know what you're doing,
Yes.
it's simple. But for an everyday patient or a layman like me, it's like, it scares the heck out of me.
Yes.
But, I mean, you made it sound so simple. And I guess you can't see him, but he's so calm and confident and it's precise. It's relaxing to know that a young man like Dr. Nzoma is able to do that with total confidence. Yeah, I know, again, I can't tell you how much my sister brags about you to this day, And I guess if I had to go through it, I definitely, she definitely recommended you. And, meeting you, for the second time and all, I would feel totally comfortable doing it. Have you had any difficult procedures or anything like that? Because, I mean, you make it sound like it's nothing. Have you had any?
Yeah, there are difficult ones. Yeah, there are difficult ones. Like I mentioned, if someone's had a bad hip for a long time and it's like stuck.
I mean, have you had to deal with one?
I've had to, yes, absolutely. And so you have to take your time and make more releases. But eventually it's the same thing. It's still just anatomy and, me going step by step. I make a few adjustments and I get through it. But difficult cases come, every once in a while for all of us doing it. But I've been very pleased. And it's funny you say about your sister. To me as a surgeon, what we do is our job, and so in some of that ways it's routine. But for me, when I meet someone like her and I'm able to make an impact like I've been able to have for her,
you have no idea, man.
It's something that's like it's like a badge, for me, if I went through all this just to help her, like it would have been worth it because of the value that she's gotten from it. And it just helps, almost like makes it all worth it. Like that something that we do is able to make such a difference in someone's life.
Yeah, well, the only problem I have with the procedure you did for her is now she won't stop working. She drags me up and down the road up north day in and day out to work at the place up there. And I'm like, relax. And she just keeps moving. So that is really a testament of the job that you've done. Again, like I said, just a year ago or whatever it was, maybe a year and a half ago, she was just hobbling. And ladies and gentlemen, I cannot tell you the difference that this young man has made in my sister's life. She is moving around like she's 16 again. So is there anything else you'd like to say about what you... well, let me ask you, do you plan on spreading your office and opening up new offices and stuff like that?
Well, I think that...
Or are you just going to stay in the one location?
I'm open to other locations. I do have an office location on the east side that's coming up, and then I am working with other places, but I'm in Southfield now. Eventually, I want a Detroit location. I think that would be ideal for me as well. But the only other thing I would say is surgery is great, but, being African-American, working in the African-American community, I would be remiss if I didn't say that for us, healthcare is not equal. I even recall I see a urologist. He told me about prostate cancer. And he said, it's not the same disease if you're black, basically like that. And so there are things that we don't understand completely. So part of what I do is really trying to promote. Maybe you can't fix everything, but be aware of what your current health status is. Make sure you get the checkups and things like that to deal with problems before they get bad. And that's kind of a big part of what I'm promoting. It's hard for me to promote myself, but that's something I can get behind. But I want people to be as safe as possible should you choose to have surgery, so that you can recover and benefit and not have the side effects and risks and problems that we see more commonly with people who aren't as healthy.
Okay, you mentioned it, and I thought about asking you that, but I didn't want to. I said, but since you brought it up, why do you think there's such a disparity between health care for cousins, as I call them, and black Americans, black people?
I don't know that there's no data that explains it, but I would my guess, and it's just a guess, is that I think that we deal with a level of stress that affects our bodies differently. Mm-hmm. There's not a great way of measuring stress. Some people say measure cortisol level that's elevated. Imagine if you saw a tiger in front of you, like your body will gear up to run away from that tiger, mm-hmm. right? And that's a stressful reaction. And that's what happens to the deer or the antelope when that happens. They get ready you have the power to run, to do all kinds of things in that situation, run or fight. But as soon as that threat is gone, that should go away. But I feel like in our case, we're always in that stress zone. Edge. And I think that leads to the high blood pressure and among other things. But in addition to that, there are lifestyle things. There's better ways to eat that are proven. It's definitely important to be physically active. I promote that. That's important. And so lifestyle medicine is something that I actually got training in, which are 6 pillars to help prevent those things. And you can't fix every problem, but I think stress is a big one. The 6 pillars are eating a nutritious diet. The more healthy foods, the better. Whole food, non-processed foods, plant-based if possible. Those are the key. Physical activity means you walk at least 30 minutes a day, 5 days a week. It could be 10 minutes for breakfast, lunch, and dinner. You need to strengthen your muscles twice a week. You need to stretch every day. That's physical activity. And then the other things that aren't so obvious are social support. Having a brother or sister, spending time with your family or your church group or your sports group. The more groups that you have in your life that make you feel like you are heard, that you're not alone, that's probably, I would say, one of the most important things for your health that people don't pay attention to. So those are the 3 pillars. The 4th would be managing stress. And I think that comes back to what we just mentioned for mm-hmm. African Americans. So I'm really curious to measure stress. And so one thing that we have is called heart rate variability. If you have an iPhone or a watch, those are ways you can measure it. I bought my wife an Aura ring, which measures like her sleep. It also measures her heart rate variability. And that's something that if you take you take it and it's low, which is not good, and you close your eyes and do some deep breathing, and you retake it, you'll see that can raise your heart rate variability. And so those are things that we can do in our community to kind of know where we stand with that. How much stress do we have? And it's not something you can look at someone and say you're stressed, but it's something that we feel, mm-hmm. just like high blood pressure is part of that as well. So stress management. And then the other 2 are avoiding substances like alcohol and tobacco are the main ones, but any kind of substance that's not good for you that oftentimes people use to deal with stress mm-hmm. the wrong way, it's not good for you. And so having more social support can help offset that. And then the last one is getting enough sleep, believe it or not. So sleep is huge. There's a lot of sleep science. There's a guy I follow. He has great videos that explain why we need sleep, and they did studies on depriving people of sleep, and what they found was amazing. So you just want to get somewhere between 7.5 to or more up to maybe 9. Everyone's different. Maybe you don't need that much, but as long as your sleep is consistent and for that period of time, then that's the time where your body heals and you recover. So those are the things that I would promote, things that I will talk to patients about, and try to make sure that people know more about them.
Okay. What are your plans for the future going forward?
Oh, that's a great question. I love what I do. I want to do it as long as I can, but it's not the only thing. Like I said, I do want to promote health, whether it be in churches, schools, businesses. Lifestyle medicine is one of those things where even Blue Cross Blue Shield would be interested in having a physician talk about these things. And I don't want to just talk about it. I want to tell people this is what I actually do. You know, I had high blood pressure for many, many years. I changed my diet, changed my activities, and I was taken off of it. But that's not the common thing that happens. But I still have to check my blood pressure. I have to manage my stress and make sure that it doesn't come back. But those are things I want to share, like my journey and, you know, demonstrations, etc. But my goal is just to be of value, to offer service, and to live a life that's valuable. But going back to being able to help people like your sister, that's what really warms my heart and makes me feel like I'm here for some reason and I'm doing something of value.
Okay. We're out of time. I'd like to thank you for coming. But first of all, how can people get in touch with you? Give us your address, your phone number if you want, your email address and all that kind of stuff.
Sure, absolutely. So my email address is dr, as in doctor. My last name is Nzoma, and that's at detortho.com. That's my personal email. I'll give it to whoever wants to use it. I'm happy to answer questions, to be of service. My office number is 313-327-2194. Again, that's 313-327-2194. And my office currently is in Southfield. It's on Lasser at 11 Mile, just behind the post office. And that address is 27207 Lasser Road. Our suite is on the second floor, 250B as in boy. And that's 48034. So I'm happy to help.
Okay, Dr. Nzoma, I would like to thank you for showing up and coming, taking time. Ladies and gentlemen, he left his office to come over here and sit down and talk with us. I appreciate it. I thank you very much. I wish you much success. Continue doing what you're doing, helping people like my sister. And ladies and gentlemen, this is it for The Hook. I'm Keith Butler with my guest, Dr. Joseph Nzoma. And I hope you enjoyed this little talk. And we'll see you next week, next show, next episode. Stay warm, stay safe. Peace.